Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Social isolation and loneliness are an indication of the number of social supports and the perceived quality of those connections. In the previous episode, we highlighted some important distinctions between the concepts of social isolation and loneliness with our guest, Dr. Mehrete Girmay, a public health analyst based in the United States. She remains with us in this episode to transition our conversation as we take a closer look at how social isolation and loneliness impacts health outcomes, their disproportionate impact on the senior population, and the need for a creative systems thinking approach. This is where we left off in our conversation.
Loneliness, as we've discussed, can be considered a social determinant of health. And for public health, for better or for worse, it is often deeply entangled with, politics. And in the political realm, the policymakers and decision makers often want kind of a economic justification in order to move policies forward. So what are some of those, if you can speak to it, more tangible economic impacts of, this so-called epidemic of loneliness? I know from one study that I've seen, it's estimated that specifically social isolation among older adults costed the Medicare system in the United States, I think it was in 2016, $6.7 billion. So, and I've heard from various podcasts I've listened to with clinicians talking about their experience with older patients. They say a lot of times when they get doctor's visits, people come in just because they feel alone and they have no one to talk to. So, it's putting the onus on a lot of times healthcare providers as the go-to person in a sense, when maybe there's public health interventions that can kind of address it without putting that burden on healthcare specific. Because loneliness, while healthcare practitioners are allies in this, the burden shouldn't lie solely with them to address the problem.
Yeah, I certainly agree. Social connections, I think now, again, with everything that's sort of happening, we're able to see, the significant effect that it's having on health, right? So, and I believe that I'm confident that the field of public health, like you said, not just placing the burden on, physicians or providers, they'll continue to embrace the need for more of a SDOH, social determinants of health focused solutions. But I think to address it, to be honest, it's going to require, at least what I believe, a multi-pronged approach, right? And one that requires, an all hands on deck approach, really. I think it's going to take some creativity, thinking outside of the box and utilizing support groups, like you said, not even just within the healthcare system, but these support groups and therapy, counseling services, in ways that meet people where they are. So as we consider, how socioeconomic status plays a part, living standards, barriers to access to treatment and care, not everyone's going to reach out for services if they're feeling socially isolated or lonely. So if these services are in place and offered, perhaps with reduced fees or even free of charge, people will be more inclined, obviously, to utilize, these services. So, it's important for everyone, just like you mentioned, that everyone is dedicated to remaining cognizant of how important of an issue this is. And then also, as we've shifted to more virtual telehealth forums, how that plays a part in the digital divide. I just want to make sure that, because there's a true digital divide that's there. And what that doesn't only mean access to broadband internet, right? It means also the utilization, because, if we reference again the senior population, even if they have the access to the internet and they have a laptop or a desktop, sometimes the utilization and the frequency, of usage also plays a part. Right. Yeah. So, it's going to.
Right. And that's one thing I hope to touch on a little bit more later in our solutions. But I want to piggyback on that point that you made about community services to provide social networks to people. Yeah. But in the context of, COVID-19, to prevent the spread of the disease, a lot of these public health measures that were put in place to protect the overall health of the population also meant that a lot of these programs and services that people rely on in the community were no longer being offered outright, or the capacity was limited, and then the populations in which they were meant to be serving, that connection was broken by all these various measures that were implemented. So I want to talk a little bit more about in the current situation that we're in with COVID-19. COVID-19 specifically poses such a great health risk to older adults and seniors that we've been talking about in this episode. So it's like people are listening. The immediate effect of COVID-19 means like a lot of people get hospitalized and all those horrible symptoms, and a lot of people do die, especially seniors. But why should we still care about loneliness in the context of COVID-19?
I think it's especially important now. I think if we didn't value social connection before, we certainly do now. I think, many of us took for granted, just going out and having a coffee with a friend and sitting, in a coffee shop, a local coffee shop, and just, sharing positive energy, amongst each other. And, if you're going to church, wherever your place of worship is, I think a lot of those things, many of us may have taken for granted. And so it's so important right now that we understand first, as we've mentioned, the difference between the two, social isolation and loneliness, but also its connection with what we're dealing with, and what the, at least for me, what the implications can be. And so if we're not aware, and if we don't know what the differences are and what they can look like from person to person, we run the risk of missing the mark. We run the risk of overlooking people that may be dealing with these issues. And so, it's important that we remain aware of what, the physical health outcomes can be from social isolation and loneliness, but also the mental health. And so it's important for everyone to be aware. I think it's not only, like you mentioned earlier, it's not just for the healthcare providers, but community workers, because again, community-based mental health professionals, they're key segments of the mental health workforce, and so It's important that, they have a seat at the table as well, and that they are informed about what people are actually dealing with in order to meet the needs of the population.
So I think the point that you mentioned earlier, and the one that you've just kind of reiterated, the idea of moving beyond the healthcare system and having a multi-sectoral approach to loneliness and social isolation, that really resonated with myself. Because I think one of the strategies for tackling this issue is the involvement of, let's say, your employers and just the workplace, is having loneliness and social isolation as part of the discussion in the workplace. I think that's a very key part of this discussion, because oftentimes, when in the workplace, when we talk about things like work leave or sick leave, things like that, it's often for very much, physical pain or a noticeable injury or things like that. But it's only, I think, been recently mental health is coming in the discussion. And I think another big part of this would be this discussion around social isolation and how can employers support their employees in the workplace to be able to provide necessary resources or services to help deal with this as well. And I think in the COVID-19 context, especially for older adults, I think it's very important that social isolation and loneliness is also considered, because, like you mentioned, even just coping with what's going on around the world, and when you're hearing in the news about the number of deaths, the number of cases jumping each and every day, there really needs to be some sort of system to help individuals or communities band together and support one another during a crisis like this.
Yeah, absolutely. Yeah. I think what we've been dealing with, it's being under lockdown orders for, an indefinite amount of time has been, certainly challenging for many people. So I suspect, many mental health ramifications of isolation. So yeah, absolutely. Everything you said is very much true. And hopefully, workplaces will support that. And I'm sure they will. I'm confident that they will.
Yeah. And I would say the two even go together, because a lot of, seniors who are retired do a lot of community work in those very programs and services that we're talking about.
Yeah.
And we know that feeling a sense of purpose in your life can also protect against loneliness and social isolation. So when, there's a lot of peer support programs that maybe before the pandemic, they were, in person, there wasn't as much of a focus on remote or virtual services. And now that it's been disrupted by the lockdown measures, so you have the clients that were meant to be served, who benefit from these services. And then the people who are volunteering their time, which is in a lot of cases are those very seniors that are at, higher risk for COVID-19 and that often experience loneliness. Those people that are providing the services are also affected by the disruption because they value the input that they can put in the community. And it goes to Will's point then, these people also need to be supported, not only the clients, but they need to be supported in whatever mental health issues that they're experiencing as well.
Will, you raised a good point though, in terms of how, I guess, our kind of corporate grind culture, we don't really talk about feeling lonely. It's kind of stigmatized. So perhaps a positive of COVID-19 is, when we do emerge from this, that there'll be more openness to talking about feeling isolated, feeling lonely, and because we know the impact of it. And so, yeah, I'm always an advocate for talking about emotional feeling things that sometimes seems, it's not professional, but like after this pandemic, I think hopefully there will be a change.
Yeah, and something that I've felt is that, especially in the corporate environment, it's often about productivity, who can do more in, I guess, less time, and pretty competitive environment sometimes, when you have to kind of meet deadlines and things like that. And it's definitely almost like a breeding ground for, say, social isolation or even feelings of loneliness when you feel like instead of a team, it's more of competitors that you're with. Obviously, this is very much specific for depending on the work environment, but I think it seems to be something that I've definitely experienced and that people who I know have experienced as well.
Yeah, that's a good point too, because if you think about it, when you're working remotely from home, I'm sure there's people in your workplace, there's a few of them that you value, the connection when you go to work, right? I know me personally, I have a couple, colleagues there that I get along with very well. And, if you see them looking down, you look a little off today. But with remote work, you get the Zoom and the camera set up. It's a 30-hour meeting and everyone's gone and no one really knows. Okay, is Will being overworked? I haven't really seen him in 4 months. You assume that, but you're at home, so you can talk to your friends and stuff. But we also have a lot of social connections in work. Yeah. We spend a lot of time. Before this, we spent, a lot of our waking hours at work. And even though we're working from home, we're still spending a lot of our waking hours doing what we're getting paid to do. And a lot of times, a lot of those people that can help you throughout the day are your coworkers. And we're not really getting those connections working from home as much as we did before.
I agree with everything that y'all are saying. Yeah, absolutely. I think I don't know if we valued the beauty of going into work as much as we should have. We appreciated those telework days. And then I think for many people, like you said, you just don't know now because our meetings are, typically, like you said, 30 minutes to an hour. And you just don't know what people are dealing with. No one's, through a camera going to share unless you have outside of the workplace where you talk on the phone or you text. If you don't have that in place, then you'll never know what people are really dealing with. So that's a very good point.
It's like, if you go on the Zoom call with your boss or, you have a group call and there's, how's everyone doing? Are you really going to say I'm not doing it?
I'm not.
You know what I mean? It's like, no, but that's true though. But it's like, I would also say the person asking the question doesn't necessarily want to hear I'm anything other than, it's good. So knowing that, you don't really want to say, I'm not doing well today. You know what I mean? So I think it also goes back to what Will says, is like the workplace culture in of itself. If our workplaces kind of push the message, okay, if you don't feel this, please let us know. We know it's then acceptable then to say, and we won't be stigmatized for it, as what you were saying, Linda, before.
But why not? Why don't we normalize that though,
Yes, loneliness policy. Which leads us very nicely into our segue into, we talked about all the things that are wrong in the world. Just kidding. We just talked about, how seriously we should take the issue of loneliness, and how loneliness can influence our mental health and well-being. But being public health professionals, being the public health professionals that we are, we also have to get into what kind of things can be done to prevent or address kind of this inevitability of social isolation and loneliness. And I want to start with, first and foremost, what is kind of the role of, at the basic level, what is the role of health promotion in raising awareness and skill building in terms of loneliness and social isolation?
Well, that's an excellent question. I think first and foremost, it's doing what we're doing now. I think highlighting the differences between social isolation and loneliness, also understanding their connection, their impact, and how it can affect different populations, different demographics, and the extent to which it can affect. And like we've also highlighted, the physical health outcomes related to social isolation and loneliness, the mental health outcomes. And, everything that we've been talking about has just, for me, I'm sitting here thinking, we have just on a personal level, as Linda's been mentioning, we have the ability to sort of allow that to be reflected in our professional lives as well, right? So if you are someone that is empathetic, and someone might be dealing with something, as we've been discussing, maybe at work, you're just sensing, even if it's during that 30-minute Zoom call, you just sense something, maybe amiss and your personality change. It's okay to reach out. We have options, through social networks, talking on the phone, sending an email. All of these things can produce positive health outcomes relative to mental health, so we have those options. And I think, in conjunction with what we've mentioned around the workplace supporting mental health days, or just sort of taking a breather and stepping away from work, I think we've thought, or many people think that, as you're teleworking, there might be less work. And I'm not too sure that's true. I think that, actually during this time of transition, through everything being virtual, there's still the same amount of work, if not more. And so, if you see something is off, with a colleague or a friend, it's okay to reach out and say, I'm here. Just offering a listening ear can certainly go far. But I think from the public health practitioner standpoint, it's certainly important that, again, they are aware of the differences and how it can manifest itself depending on the other, compounding issues that may play a part. So again, we sort of touched on digital divide earlier, right? For people that are socially isolated or feeling lonely right now, and they're also having the issue of maybe a lack of internet access, or if they do have the internet, like we mentioned, the utilization, it may be, may not be as well versed with, utilizing social media or staying connected through email. And so, it's sort of meeting people where they are and understanding that we do have differences, and that's okay. But it's going to be important that we that have a little bit more knowledge as it relates to social isolation and loneliness, then we go out and we inform the public, be it through, like we're doing now through a podcast or social media, other platforms, whatever it is, to let people know that, we see you, you're valued, you're heard, and, this is what's in place, promoting those efforts that may be in place or that need to be implemented to meet their needs.
Yeah, absolutely. And another thing that we can even see within the context of this pandemic and in terms of promoting social connection as public health messaging was the initial kind of situation with the term social distancing and physical distancing. So initially, the term social distancing, at least in Canada, was used pretty often to kind of indicate that you should stay 2 meters away or 6 feet apart from people as a means to limit the transmission of COVID-19. But I think it may have been misinterpreted at some point to mean, you can't see people, you can't talk to people, and you can't stay connected with people anymore. So I think it's important in terms of health communication that when we're broadcasting these terms and we're telling people to do things, we need to be clear as to what are the implications that could come if you use a term like social distancing.
Unfortunately, many, have taken the physical social distancing mandate to also mean socially distancing, emotionally, personally, when in fact, we should be attempting to be more socially connected, right? And so we know how that can help with feelings around stress, fear, anxiety, et cetera. So again, yeah, absolutely. Like, I think it's just important that everyone realizes that we are dealing with very challenging times, and it's okay to sort of overextend yourself at times if you feel that you're okay enough to do so. And it's also perfectly okay to recognize if you're not okay to do that and you want someone to reach out to you. So it's really, in essence, figuring out where you stand and, pouring from a full cup, essentially.
Yeah, LaShawn, I'm glad you brought up the point of social distancing, because we know that that term has been used in previous epidemics in the sense of H1N1. So I feel like it was very much in the sense of public health messaging. Let's use this term and we're going to use it for COVID-19. Oh no, COVID-19 turned out to be a lot worse than we thought it would ever be. Now we have to evolve this term into more physical distancing. And it's unfortunate because we know that the older population is at risk more so than others, and they're also at risk of loneliness and isolation, that the two came together as a perfect storm in order to worsen these outcomes.
Yeah, and just to put a ribbon on that as well, when all these messages, whether it's physical distancing or social distancing, I don't know if it's an implicit kind of thing where it normalizes experiences of loneliness. It's like, okay, since you're not allowed to see your family who may live in the same city as you, maybe you're not, if you're a grandparent, you can't see your children or your grandchildren, you're supposed to feel lonely because that's just the situation we're in. And that goes back to what Linda mentioned earlier about the stigma. So you can follow these public health recommendations to stay at home and go out for essential trips only and stuff like that. But that we should make it clear that that doesn't make it okay if you feel lonely, and that you should be reaching out if that's the case. So one of those tools that we can use to reach out to people is, as we know, social media and other kind of technology. People use FaceTime, and I don't know if I'm kind of old, so Instagram Live.
You're carbon dating yourself.
Instagram Live or whatever, Zoom and Skype and all these things that at least help you make the best of a bad situation. So if we can talk about a little bit more about how we can safely kind of integrate technology in our lives as a medium to maintain the quality and the friendships that we have with other people.
I mean, it's just so important that, again, pouring into others from hopefully you being, having a full cup yourself. And sometimes we can overextend ourselves and we're not even doing well on, from our end. And so it's important that we take care of ourselves, that we nurture ourselves. And once you are well, that you reach out to others and you feel that you make sure that you're still connected. So any friendships, existing or new, I'm not sure how you'll make new friendships unless it's through, social media platforms, but, it's okay to reach out. It's okay to send a text. It's okay to utilize social media in a positive way. Even through LinkedIn, even through, if it, like you mentioned, Instagram or Twitter. For a lot of people, I think just having those sort of spaces and forums in place is allowing them to still feel connected. And for people that live alone, it's especially trying times, right? And so, yeah, if you do know that someone lives alone and they are limited because they're not able to fly and be with their family or travel, it's okay to sort of send a letter in the mail. I'm someone that supports just, sending a quick text, just a check-in. How are you doing? How's the day going? How's it unfolding for you? How's work? There's nothing wrong with that. And it's certainly during this time, I'm sure it'll be appreciated.
Right. But that also goes back to kind of in a sense, I think this new term I learned, the loneliness paradox, where, the fact that we have these digital tools like social media that should make us feel more socially connected, in reality can in some cases increase people's experience with loneliness. So, and that kind of goes back to the digital divide on one hand, and then on the other hand, maybe the quality of those connections through social media and stuff aren't the best quality. And then we know that in terms of social isolation, as we discussed, a crucial indicator of social isolation is not only the frequency of contact, is also the quality of contact. Yeah. And if we place a lot of our value on our self-worth from social media, and we know it can be a grueling world at times, as we've seen, especially on things like Twitter. Maybe the more you grow your social media networks, the more lonely you feel because you feel more separated.
Right. But that's also difficult to even conceptualize because loneliness is so subjective. One person might get like 200 likes on an Instagram post, and then that for them is enough for them not to feel lonely anymore. Do you know what I mean?
Right.
So for them, that's a very quality interaction within a social network. Whereas for someone else, it might be a low dopamine high. And then they realize, why, I don't actually know any of these people. Right. So
Right.
like it's difficult also then we get into the like the different populations and the age, because we know that the literature shows that this whole more socially connected but still lonely affects more of the younger population because they're more tapped in. Whereas then we have the older adults where we may not be seeing that much because there's barriers to even accessing these social networks through either digital literacy or not even having that amount of social connections in the first place, not having the bandwidth to engage. So it's super complex. And like you said, it's a paradox. Like we need to get more connected at the time of COVID-19, but are we actually getting more lonely because of it? Is it this ruthless cycle that keeps perpetuating itself?
Yeah. And I feel like as part of the quality of social contact, definitely the physical element should be always considered because of the social beings we are, especially for the elderly population who didn't grow up with these technological tools. So this needs to be addressed.
And that's a good point too. And part of the great thing about public health and the perspective that practitioners can bring to the conversation is we have to recognize the unique needs of each population. And in the context of social isolation and loneliness, the interventions that we might come up for the younger generation that may or may not involve digital solutions or social media. On the other hand, you have seniors where we have to come up with interventions that fit their unique needs. So in this context, we talk about community-based interventions, which often, I know in Windsor, where I work, there was a lot of kind of check-in and phone-based services that were developed as a result to kind of check in on seniors who live alone during the pandemic and see and connect them to, meal services or, transport services to bring them to essential doctor's appointments and stuff like that. And sometimes the best interventions don't have to be something that's new, right? Sometimes it's using something that is very user-friendly for a population and kind of scaling it up and having like a higher uptake on it. And who knew something like phone calls and wellness checks would work so miraculously for seniors, right? And then lastly, we kind of touched on this a little bit earlier, but in terms of the role the healthcare system has to play in addressing loneliness, because we know that people who self-report loneliness specifically tend to have a higher usage rate of, maybe going to the hospital or ER and stuff like that. So what role can maybe a provider play in addressing loneliness? And maybe how can public health specifically support healthcare practitioners with loneliness?
Right. I think even before we go to that practitioner level, I think we'd be remiss if we don't mention what they're doing up in the UK. Right. So as you all may have known, they actually had a position in place called the Minister of Loneliness.
That's so cool.
Yeah. And what that really entailed, it entailed a bunch of things surrounding what we've been talking about and like understanding all the health implications. And as a result, they kind of created a framework that's going to be implemented, or it's currently being implemented. So one of those things is what I already touched on, which was having kind of a nationwide adoption of a way to measure loneliness. So they're actually using that UCLA scale that I was mentioning earlier. And even beyond this, they want to use that framework to improve and connect social services by using things like social prescribing. And I don't know if you guys are aware of what social prescribing is, but it's going beyond the fact that everything can be treated by medication. So maybe as a physician, if you notice that someone is feeling lonely or it has social isolation, you could prescribe a ticket to a museum or movie tickets to, get that social connection, or even prescribe things to do with community services to get you more engaged in the community and
playing
make those
bingo
connections.
And stuff like
exactly,
that.
Playing bingo and stuff like that. And so I think having these frameworks and having commitment at these high levels of the government really goes a long way to, reduce the stigma surrounding issues such as loneliness. And they, in the UK, they do have a lot of public health campaigns that raise awareness to reduce the stigma surrounding loneliness.
That's great.
Yeah, really innovative strategy. And I think it definitely will have to depend on the culture or the values of the society of the government. And I can imagine, for example, here we do have something similar, I know, in Alberta, but it's not free. So somebody has to pay for it. And some things, for example, there are prescriptions for a gym membership, and the client can get like a week going to a gym. But then, you know, some people, it's a cost. It's difficult to afford. And so, like, it's interesting to see how different places around the world are responding. And I love what they're doing in the UK. But I was curious, and Mehrete, maybe you could speak to this from your research too. In different places around the world, the way that isolation or loneliness is kind of treated is done differently, and how older adults are cared for is done differently. And so we know in our North American context, we have a lot of long-term care homes and things like that. But I know in other cultures, that's not a thing. Like, elderly live with the family. They wouldn't be on their own anyway. And I was wondering if you had seen in your research with international students a difference depending on people's cultural background. So if they're more from a more collective culture versus this North American culture that is a bit more individualist.
Yeah, that's a great question, Linda. Yeah, I did learn through the research that, like you said, because there are some differences based off of culture, you know, for the participants, many of them, this was their first time being in the U.S. and also being away from their loved ones. And for many of them, they lived within a home, you know, that included their parents, their husbands for some of the women, and their children, cousins, aunts. Yeah. And so absolutely that was, you know, being away from that many family members and loved ones was certainly, I would say, a bit more impactful and impacted them in different ways. And so, you know, it not only affected their feelings of loneliness and the lack of the social connection, but it had impact on their, in addition to what academics can bring with it in general in graduate school, you know, the rigor and all of those things that come along with, you know, or that bring about stress, they also had, you know, coupled with that were these feelings of just being away from that many family members and loved ones that they had to also deal with. So yeah, we do have to consider, you know, the cultural piece to this and how different cultures understand loneliness and social isolation. And so, you know, that's why it's going to be so important that, you know, social services providers, you know, and community-based mental health professionals, you know, really are dedicated to working collaboratively to address this issue. So, you know, we have to always remember that, you know, home or community-based services can bring with it, you know, a set of challenges that, you know, clinic-based treatment, such as different scopes of care may bring with it. You know, so we just have to always be cognizant of these differences and how culture plays a part, like you mentioned, different demographics. And of course, you know, this is why understanding how compounding issues such as, you know, transportation, living standards, you know, where you live in relative to any services that may be in place. If they're not free of charge, where are you going to allocate your funds? Are you going to say, I'm going to dedicate the funds that I do have to the actual services, or getting to, you know, if it requires transportation, what am I going to dedicate my funds to, which is more important? You know, obviously it's getting to the services, but it may not happen for some people, you know, and so we have to always consider, you know, all the sort of moving pieces that are important. And so, you know, again, it's going to just take a collaborative approach to really bring forth change.
I think to tie it up nicely, with the role of healthcare in addressing loneliness is to kind of provide that patient-centered approach to a problem that can be unique from person to person. Whereas, you know, public health is trying to understand how people experience loneliness at the population level. So, you know, things like environmental factors, you know, I know Will loves sustainable cities, how cities are designed, built environments, right? I have read that does have an impact on how people perceived their relationships and communities and stuff like that. So loneliness and social isolation is a very complex issue, and we can probably speak about it for hours. But we want to thank you, Dr. Mehrete Girmay, and we want to thank you for coming on for discussing this incredible topic, and would like to give you an opportunity for any last words, anything you maybe wanted to say but didn't get a chance to say.
Oh, thank you so much. I enjoyed my time with you all and learning from you and sharing perspective where I can. And, you know, I'm hopeful and optimistic that all that we've been dealing with will bring forth positive change, highlighting issues that might have been overlooked before. So thank you for having me. I enjoyed myself. Thank you.
Thank you for joining us.
Thank you very much.
Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.